just, in regards to the high quality, coordinated, consistent care and service, how does your recommendations overcome the barriers that have to do with, Medicaid, other insurances, and basically the access, because as you know, some insurance companies, they only cover certain types of things, which can affect, the quality of care that the patient actually receives. So how does your recommendations kind of help overcome those barriers?
I think the first steps that you'll see in our report and that you'll see moving in the next calendar year start with, we did in this state in the 90s, we really got rid of a lot of the old infrastructure of how we delivered mental health care services. We got rid of all our psychiatric hospitals, largely, most of them, and had this idea that we wanted care to be community-based. And it's, I think, motivated by good. The idea was motivated by good, but then when we sent all of this care back to communities, it's never really had enough funding to do everything that we need. And one of the biggest challenges is a lot of our community mental health agencies don't have very much general fund money. They don't have flexible money. So they end up having to primarily serve folks with Medicaid. And with the small amount of money that they have left over, they have to only they have to triage. And so a lot of them have decided to take care of only those with the most serious diagnoses, those that need the most serious care. And so a lot of our folks with sort of low to moderate needs just they're not being met. Their needs aren't being met if they don't have Medicaid. So the first thing we wanted to do is find a way to put more general fund support into all of our community mental health agencies so that even if you're not Medicaid eligible, even if you have private pay insurance, you should be able to go to your community mental health agency and get better care as we move forward. And one of the other things was that we realized as we went out around the state and had these hearings, CMH to CMH, people are getting really different programs are being run, different care, again, the same challenge that we've had before, different evaluations, different, interpretations, and so we want some standardization there. So it's not supposed to matter what county you live in, like you should be able to get good quality care, whether you're in a small, a lowly populated county or a big, or one of the big ones, Wayne or Kent, or so you'll see us trying to standardize a little bit more and to support our community mental health agencies with more general fund so that they can help serve more people. It's not going to do everything that we need to do, and your question is, it's a great one, it's an important one, but what we really felt like with this report, we can start to take first steps, and if we even can do, take one step on each of these recommendations that we have, I think it will be so empowering for so many of the advocates and the families that have wanted these changes. It will really make a true difference in the quality of life for so many of our citizens, and I think it will just give our colleagues the sort of political backbone to keep making the changes that it's going to take, and frankly, spending the money. It's going to be, that's a big part of what we're trying to do in this first year is show some successes, so that we can show people it's worth the investment. The return on this investment in terms of our citizens' quality of life, in terms of their families' quality of life, and the financial bottom line of the state will all be improved if we can do some of this work.
Build early momentum. This is my management consultant coming up, but Governor Snyder is a business person.
Yeah.
So everything in terms of, you mentioned, Mark, about advocacy going forward, it has to be presented as a business case. It has to make economic sense. It's about healthier Michigan. It's about the economics, and that resonates. The other thing, as a management consultant, and generally speaking, in organizational change, you're dealing with culture, and there's a school of thought that you can't change culture in an organization. It just is. It's a very powerful force. So what we're taking on here is not something that's going to be easy. Typically, I would say to my clients, it's going to be a 3 to 5 year effort, and that's the reality. But wonderful, totally get it in terms of build that early momentum. It builds confidence. People will go, oh, it worked. We can actually make a difference. And boy, once that empowerment resides in a lot of people, it'll make a big. It'll really be helpful to our state and the people. So But the devil's in the details. And, you know, this Medicaid, who's 10 visits a year for straight Medicaid, 20 visits a year for HMO. I mean, we've got a lot of work to do on the details.
I definitely see that within my agency. You know, I work in the ACT program, so we're the most intensive program in the agency, but it all boils down to, you know, not their mental health status, but, and, you know, we tried to send, you know, gateway letters saying, hey, can we keep these clients? And they said no to all of them. You know, and the bottom line is the funding, you know, so those clients that don't have Medicaid, you know, or are in spin downs, you know, they're going to be transferred to case management, which is, what, 15 minutes a month, you know, 4 hours a year.
Yeah,
You know, we
and
see them 3 or 4 times a year. So you can imagine, you know, especially like our therapy clients too.
I went and observed the Brooklyn Mental Health Court in Brooklyn, New York, which is considered one of the best ones in the nation. And one of the first things that the clinical director of that court said to me, it's easier to see a judge than a psychiatrist in this community. And when it comes to this Medicaid issue of, in our community, therapists, there's a lot of therapists in our community, but they're not on the Medicaid approved provider list. So there's a real opportunity there. But all I can tell you from an N of 1, whenever I pick up my daughter after her 50-minute session with her talk therapist, she is in a much better place. So for some people, this is a really important part of therapy. It can really work for some. It can really be helpful to some.